Hello everyone, I'm Dr. Swagatesh Bastia, Director and Co-founder of Alleviate Pain Management in Bangalore. Today we have with us Mrs. Shweta Kasera. Thank you so much for being here and giving us your time. So, Mrs. Shweta Kasera is a chef and she came to us with chronic wrist pain. So, I think you came to us, say, 5-6 months back?
Yes.
Can you tell everyone what symptoms you were suffering from? What were your complaints when you reached out to us?
Sure, doctor. I had a wrist, I had an injury in my right wrist, a sports related injury, due to which I had a sprain bandage on for some time, and
Right.
I had a lot of pain in my right wrist. I tried all sorts of medication, but the pain didn't go down, and I wasn't sure what the pain was because of.
Yes. So, from a medical point of view, when Shweta came to us, she was having this recurrent pain in the wrist because of an injury, and on investigation, an MRI showed a small TFCC injury. Plus, the other important thing that we noticed was there was more laxity in this wrist as compared to the other wrist. So, did you feel that this wrist had become a little bit more loose? You remember we discussing this at length. So, could you just elaborate that?
Yeah, sure. I didn't have the same strength as I did before, the same sort of, I couldn't use it for the same activities professionally or even at home.
Right.
I have toddlers and I use my wrist a lot.
Right.
This seemed stronger than this, and this said I was almost scared of injuring it again.
Absolutely. And so you took the other treatments, but how much relief did you find?
I've been to various orthopedic doctors, and and they were all trying to figure out what it was, and they dismissed it most of the time with
Sure.
medication or sprain bandages or
Right.
what have you.
Right.
But no, didn't really help.
Right. So when Shweta came to us, we saw that the wrist was more lax, and as well as there was a TFCC injury, which was giving her grief. So we decided to treat her with Comprehensive PRP Prolotherapy, and she underwent, I think, 4 sessions of PRP Prolotherapy with us, say over a span of 2 to 3 months. And we'll ask her how she has been, what was her experience during the treatment, and how she has been since then.
Sure, doctor. I actually saw a difference right after the first, and the second, third, fourth only made it better.
Right.
I do feel more strength now, and it's not as, I don't feel like it's going to fall off. So I definitely, I would recommend it to anybody who has a similar issue.
Right. So you feel this inherent strength of the wrist has become more?
Yes, I feel much more like before than I ever did.
That's great.
Yes.
That's great. So that's precisely what we want to bring about, is in terms of small soft tissue injuries and laxity. PRP prolotherapy is a very definitive treatment, as it is the easiest way to get people back on track. Obviously, we did couple it with some physical therapy, so not to miss out on that.
Yes.
And thank you so much for your time, Shweta, and hopefully many other people with pain also benefit with these treatments.
Thank you, doctor.